move to the muscle of the shoulder region. The muscle of the shoulder region divided into two groups, extrinsic group and intrinsic group. Extrinsic that originate from other region. يعني لما نقول intrinsic of the shoulder، الشولدر بتكون لي من السكابيولا والهيومرس، معناه جاي من الاسكابيولا للهيومرس. لما نقول extrinsic هي جاية من حتة تانية، لكن الانسيرشن بتاعها يا إما في الاسكابيولا or humerus. Extrinsic muscle of the shoulder region include trapezius, latissimus dorsi, levator scapulae, rhomboid minor and rhomboid major. 5 muscles again: trapezius, latissimus dorsi, levator scapulae, rhomboid minor and rhomboid major. Trapezius. This trapezius originates from the skull here, from ligament in the neck known as nuchal ligament, from spine process from the 7, and all the spine process of the thoracic region. Okay, and inserted into lateral third of the clavicle, in the acromion and in the spine. The nerve supply of this muscle by spinal part of accessory nerve. We have 12 cranial nerve. The last cranial nerve known as accessory nerve. This accessory nerve into two parts, spinal part and cranial part. The nerve supply by spinal part of accessory nerve. The action: the upper fiber or descending fiber. سميناه descending ليه؟ لأنها نازلة كده، عشان كده بنقول الأبر فايبر or descending fiber. يلا تخيلوا معاي إنه الأوريجين هو اللي هيسحب لي الانسيرشن. معناها الأبر فايبر or descending fiber هتعمل شنو؟ elevate the scapula. opposite to it ascending fiber. ascending fiber هتعمل شنو؟ descend the or depress the scapula. The middle fiber or horizontal fiber retract the scapula. Okay? Latissimus dorsi. This latissimus dorsi originates from the iliac crest in the hip bone, from the lumbar fascia, from the spine of the lower 6 thoracic vertebrae, and also originate from the last 4 ribs. This muscle inserted into floor of bicipital groove or intertubercular groove. The nerve supply by thoracodorsal nerve. The action: extend, adduct, and medial rotate the arm. Levator scapulae, rhomboid minor, rhomboid major originate from the vertebrae, cervical and thoracic, and inserted into medial border of the scapula. Levator scapulae originate from the medial border of the inserted into the medial border of the scapula above the spine. Rhomboid minor inserted into medial border of the scapula opposite the spine. Rhomboid major inserted into the medial border of the scapula from the spine to the inferior angle. Okay? Nerve supply. All these muscles, levator scapulae, rhomboid minor and rhomboid major, supplied by dorsal scapular nerve or nerve to the rhomboids. The action of this muscle: levator scapulae, from its name, elevates the scapula. Rhomboid minor and major retract the scapula. ريتراك يا اخوانا ترجع لي السكابيولا لورا، بروتراكشن تجيب لي السكابيولا لقدام. اوكي. Intrinsic muscle of the shoulder. Intrinsic muscle of the shoulder include deltoid muscle, supraspinous, infraspinous, teres minor, teres major, and subscapularis muscle. Okay, this is spine. We know the fossa above the spine is known as supraspinous fossa. So the muscle originates from the supraspinous fossa is supraspinatus muscle. The muscle originates from the infraspinous fossa is infraspinatus muscle. The muscle which originates from subscapular fossa is subscapularis muscle. The muscles that originate from the lateral border of the scapula, we have two, teres major and teres minor muscle. Okay. Start by details. Deltoid. مذكرين الانسيرشن of the scapula هو زيه inserted into lateral lip, lateral third of the clavicle, acromion and spine. ده الاوريجين بتاع منه؟ ده الاوريجين بتاع الدلتويد، هو نفسه الانسيرشن بتاع الترابيزيوس. الدلتويد externally والترابيزيوس internally. Okay. Originate from the lateral third of the clavicle, from acromion and from the spine, and inserted into deltoid tuberosity. نتذكر في الهيومرس كان في عندنا tuberosity سميناه شنو؟ الدلتويد tuberosity، معناها هي بتعمل insertion هنا. النير supply by axillary nerve. deltoid is multi-pennate muscle متعددة الألياف، عندها anterior fiber، عندها middle fiber، وعندها posterior fiber. الانتيريور فايبر بتعمل شنو؟ بتعمل فليكشن وميديال روتيشن، عكسها طوال البوستيريور فايبر بتعمل شنو؟ تعمل اكستنشن ولاترال روتيشن. the middle fiber abduct the shoulder. okay. Okay. Supraspinous, infraspinatus, teres minor. supraspinatus الاوريجين بتاعها من وين؟ من الsupraspinous fossa. infraspinatus originate from infraspinous fossa. teres minor originate from the lateral border of the scapula. all this muscle inserted into greater tuberosity. okay. يعني الانسيرشن بتاعهم الثلاثة وين؟ في الجريتر تيوبرسيتي، وسمرايز باي ست: supraspinatus, infraspinatus, teres minor. SIT ست. nerve supply. supraspinatus and infraspinatus supply by suprascapular nerve. teres minor supply by the same nerve to the deltoid. اسمه منه axillary nerve. action: supraspinatus abduct the shoulder. infraspinatus and teres major lateral rotate the shoulder. okay. Subscapularis originate from the subscapular fossa inserted into lesser tuberosity. nerve supply: upper and lower subscapular nerve. action: abduction and medial rotation of the shoulder. rotator cuff muscle. rotator cuff muscle are four muscles which hold the humerus in contact with glenoid cavity, so stabilize the shoulder joint. These Rotator cuff muscle was summarized by six: supraspinatus, infraspinatus, teres minor, and subscapularis muscle. Teres major muscle. Teres major muscle originates from the lateral border of the scapula opposite the inferior angle and inserted into medial lip of the bicipital groove. This muscle supplied by lower subscapular nerve, and it is action to adduct and medial rotate the arm or shoulder joint. Summary: we divide the muscle of the shoulder into intrinsic و extrinsic. طيب نحن قلنا الانترنسيك muscle هم منه supraspinatus, infraspinatus and subscapularis. تاني عندنا منه teres minor, teres major and deltoid. طيب نشوف الحاجات المشتركة من أساميهم. الحاجة supraspinatus, infraspinatus, teres minor inserted into lesser greater tuberosity. Subscapularis inserted into lesser tuberosity. Okay? And nerve supply: supraspinatus, infraspinatus supplied by suprascapular nerve. Subscapularis supplied by upper and lower subscapular nerve. Okay? Teres minor supplied by axillary nerve. Teres major supplied by lower subscapular nerve. Subscapularis supplied by upper and lower subscapular nerve. Okay? Extrinsic muscle include trapezius, latissimus dorsi. Okay? Include trapezius, latissimus dorsi, levator scapular, rhomboid minor, rhomboid major. Levator scapular, rhomboid minor, rhomboid major supplied by nerve to the rhomboids. Levator scapulae elevates the scapula. Rhomboid minor and rhomboid major retract the scapula. Latissimus dorsi extend, adduct and medial rotate the shoulder or the arm. Trapezius, the upper fiber elevates the scapula. Lower fiber or ascending fiber depress the scapula. Middle fiber retracts the scapula. Okay? Okay? How the structure reach the scapular region? We have the spaces. Through it, the vessels and nerve reach the scapular region and posterior part of the arm. For example, suprascapular notch. This suprascapular notch converted into suprascapular foramen by ligament. It is named transverse scapular ligament. This transverse scapular ligament converts the suprascapular notch into the foramen. The suprascapular nerve passes through it while the artery passes above to it. Okay? We have another space here known as quadriangular space. This quadriangular space surrounded by teres major muscle, teres minor, teres major muscle, by the humerus laterally, and by long head of the triceps medially. The structure passes through it is circumflex humeral artery and axillary artery. circumflex humeral artery and axillary nerve. Okay, this is quadriangular space. Here we have upper triangular space, and here is lower triangular space. The upper triangular space surrounds superiorly by teres minor, inferiorly by teres major, laterally by long head of the triceps. The structure passes through it is circumflex scapular artery. The lower triangular space surrounded by superior by teres major, laterally and medially by triceps. The structure passes through it is radian nerve and deep artery of the arm, or profonde brachii artery. Okay, that is all about shoulder region. Thank you.